Good afternoon, Dennis Taylor. My name is Mihiraa. Let's start the warm-up session. Describe your typical working day.
My day starts with a prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after giving a handover to the next scheduled staff members.
What are the pieces of advice for the upcoming nurses?
As a nurse, I can give a bunch of advice to upcoming nurses. Firstly, I advise them to love their profession. If anyone loves their profession, they can carry out their responsibilities in an efficient manner without complaints. Apart from that, I advise them to be dedicated to their profession and maintain professional standards. These are very essential because a nurse should abide by nursing ethics on any grounds. These are a few pieces of advice that I like to give to future nurses.
How do you handle the stress of the job?
To handle the stress of the job, I prioritize self-care and seek support from colleagues and loved ones. I maintain a healthy work-life balance by scheduling regular breaks, engaging in activities I enjoy outside of work, and practicing stress relief techniques such as mindfulness or exercise. Additionally, I make sure to communicate openly with my colleagues about any challenges I'm facing and seek their advice and support when needed. Taking time to decompress and recharge allows me to approach my work with renewed energy and focus, ultimately ensuring that I can continue to provide the best possible care to my patients.
Discuss the personal attributes that make you especially qualified as a nurse.
I am extremely detail-oriented. Whether I'm charting and keeping records, noting patient conditions, or administering medication, I always double-check my work. Efficiency is important, but not at the expense of accuracy, and I believe in removing as many barriers to accurate care as I possibly can. I am also very observant. I tend to notice the details about patients' conditions that others miss. Whether it's a glassy look in their eye or a certain way they are clutching their abdomen, I look for and record details that may offer clues into the causes behind a patient's condition.
How will you make a positive impact on the nursing profession?
There are different ways to contribute to making a positive impact on the nursing profession. Creating feedback forms as forms helps us secure and promote our jobs and give us the motivation to work hard. Nurses deserve better working standards and benefits for their hard work. Therefore, listen carefully to what nurses have to say to light down the workload. Additionally, provides continuing education for all to make us stay updated to be the best always.
Your preparation time is over. You can now start your roleplay.
Hi Mihiraa, thank you for allowing me to examine your foot. I can hear the concern in your voice, and I completely understand how uncomfortable this must be for you. But before we get into treatment, I'd like to ask a few more questions to understand more about your condition.
Sure, you may please ask.
Mihiraa, could you tell me more about your condition, please?
Well, it's been about 3 weeks, I think. At first, I thought it was just a little irritation from my shoes, but then the itching got worse, and the peeling started. The smell was really surprising, to be honest. I haven't had this before, and I've just been keeping it clean and trying to air it out, but nothing seems to help.
Mihiraa, I understand how frustrating this must be, and it's completely normal to wonder how something like this could happen. Fungi, like the ones that cause infections in the feet, thrive in warm, moist environments. Our feet, especially when they're in closed-toe shoes for long periods, create the perfect setting for this. The inside of your shoes can become warm and damp from sweat, and if there isn't enough ventilation, it becomes a breeding ground for fungi to grow. This doesn't mean you've done anything wrong, it's actually quite common. Factors like wearing tight-fitting shoes, excessive sweating, or even sharing personal items like towels, socks, or shoes with someone who has a fungal infection can increase the chances of getting one. When you combine these conditions with the fact that fungi spread easily, it's understandable how this could have developed. From what I have mentioned, how does this information relate to your specific situation?
That explains a lot. I wear closed-toe shoes almost always. What's the best way to treat this condition?
Mihiraa, I want to reassure you that what you're dealing with isn't anything too severe. Fungal infections like this are quite common, and the good news is that they're definitely treatable. I know it can feel a bit worrying, especially with the symptoms you've noticed, but with the right treatment, we can get this under control and clear it up. For treatment, there are a few options. One of the most effective approaches is using antifungal medications. These can come in the form of topical creams, which you apply directly to the affected area, or oral medications that work from the inside out. Since your infection seems to be mild, starting with a topical cream could be a good choice. It's straightforward to use, and you should see improvement within a couple of weeks if you apply it regularly. How does that sound to you so far?
Yes, I think I'd like to try the cream first. I'm not sure I want to take oral medication just yet.
That sounds like a reasonable choice, Mihiraa. Just remember to use the cream exactly as prescribed, and we'll keep an eye on how it's working for you. Fungal infections can be a bit tricky because they are contagious, meaning they can spread to other parts of the body or to other people if not treated properly. In some cases, if left untreated for too long, they can become more severe, but we're catching this early, so I'm confident we can avoid that. Mihiraa, do you have any concerns?
That makes sense. So, how do I prevent this from spreading?
Good question. Mihiraa, I completely understand wanting to make sure this clears up and doesn't come back. The most important thing right now is to stick with the treatment. Even if your symptoms start to improve, it's essential to complete the full course of the antifungal cream. Stopping early, even if it seems better, could allow the infection to return or spread further. To help prevent it from spreading to other parts of your body or anyone else, it's important to be mindful of a few things. Keeping your feet clean and dry is key. Make sure to wash them daily and dry them thoroughly, especially between the toes. You should also change into clean, dry socks each day, and try to avoid wearing the same shoes for long periods if they're tight or make your feet sweat. To reduce the chances of reinfection, be sure not to share personal items like towels, socks, or shoes with anyone. Fungal infections can spread easily that way. Maintaining good foot hygiene and wearing breathable footwear can make a big difference in preventing this from happening again. Does that seem manageable for you?
Of course, I'll surely follow your advice. I really want to make sure this gets better.
That's great to hear. I'll also schedule a follow-up appointment in about 2 weeks to see how things are progressing. That way, we can adjust the treatment if necessary. And if you notice any changes or concerns before then, feel free to contact the clinic.
Thank you, I appreciate that.
You're very welcome, Mihiraa. Let's get you started on the cream, and you'll be on your way to recovery in no time.